it. Do you?
Yes.
Okay, good. Well, all right. Well, we're here with Dr. Aznavour. Dr. Aznavour, let me ask you a question. There's lots of people out there who have missing teeth, 2 or 3 maybe in the back of their mouth, and they're missing for a while, a decade almost, a long time anyway, 3, 4, 5 years. And nothing really bad has happened. But at the same token, every dentist keeps saying, you got to keep your teeth, you got to replace your teeth, because otherwise all kinds of health problems will be coming, and yet not all that much is happening. So can you please shed some light on that?
Yeah, there's a couple of things that can occur if you're missing teeth, even if it's for a number of years. First of all, you want to have, you want to put the stress on the teeth equally. You want to spread that force of your chewing. So for example, you don't want always to chew on one tooth. It's better if that force, for example, is distributed to other teeth, because eventually that tooth will absorb too much force and it can fail. You may need a root canal and further treatment. So that's why one of the reasons to replace back teeth is to have a good amount of force for chewing, and so that you don't have too much force on the front teeth, which is not good for the front teeth.
I see. So the way you're explaining it to me, what comes to my mind a little bit is it's kind of if you have a door with 2 hinges and you're always using one hinge, and then you're kind of using it too much and it wears out. Is that maybe a reason also? In fact, I've heard that sometimes people have headaches or tension in the neck simply because they chew one-sided, and by chewing one-sided, well, the body isn't made to chew one-sided. The body is made to have the hinge working regularly, and that creates tension. Is there some truth to that?
That is absolutely true, because you're tending to use one muscle on one side of your face, because when you're chewing, you're using your muscles to chew, okay? And if you're using one side, you tend to use that muscle more. It can cause fatigue, which will in turn cause headaches and tension, because you have to remember that all these muscles are interconnected. For example, you have a muscle here on the side of your face, okay, that's used for chewing, and that muscle is connected to the muscle on the side of the head, which is called the temporalis. And when you clench this muscle too much, it can cause tension headaches. And that's one of the reasons why it's good to have a nice balanced bite, to have equal distribution of forces, so that you're not always chewing on one side. There's other aspects to this, of course, as subconscious clenching and things like that, which is not really have to do with missing teeth, but all this contributes to tension headaches, neck pain, because all the muscles are in some way interconnected to each other.
And I suppose one can even get like kind of that crooked smile over time. I'm sure it takes a while, but it probably, kind of will contribute to having a, somewhat distorted face, I guess.
Of course, because what can happen is if you're using one side of your mouth to chew all the time, for example, it can cause what's called TMJ, which is a temporomandibular joint, and that joint will fatigue, it'll cause clicking, things like that, and eventually, you will have a shifted bite. The way you talk sometimes will always be on one side. All those contribute to what's happening in terms of shifting your smile and chewing habits.
All right. Well, so I guess there's more to it than just, you can't chew correctly, and by doing so, your digestion may not work well, which might have something to do with when people don't chew enough. But it looks to me that the things you explained are even more, or at least equally as devastating, because running around with a headache or with a slightly crooked mouth or with a neck tension, that must cause sleeplessness and all kinds of things, and overall just simply is not a good thing.
Exactly. It can affect digestion, just like you said, because food isn't being chewed properly, and it's not being digested properly. It's not only the head area where it's going to cause problems, but it's going to cause issues in terms of digestion as well. So, and the most important is quality of life. You know, that's the most important thing we're looking at here. You want to improve your quality of life, not deteriorate it.
Well, it's quite amazing how we don't look at that something as little as a little tiny tooth or a couple of them actually affect so many body parts. But it's good to know. Well, thanks a lot, and I'm sure we're going to make a couple more videos on finding out how, where, why, and what one can do in order to replace those teeth, or maybe can do something to not even lose them in the first place. Am I right there?
Yes, that is absolutely correct.
Good. So people can visit you on the website below or on the phone number in your office, which is where, Doctor?
My office is in Newhall, California. It's 24242 Lyons Avenue in Newhall, California 91321. And our office phone number is 661 area code 260-1220.
Well, all right. We'll show that.
And if you have any questions, you can contact me.
Good. Wonderful. Thanks a lot, Dr. Aznavour.
You're welcome. It's been a pleasure.